So Tony Cunningham takes over tomorrow, so it's rather a joyous day for me, being able to hand over the reins of medical research power to Tony tomorrow. I've obviously been reflecting over the last 5 years of my involvement with the AAMRI board, and I have to say, for the medical research sector, it's been a bit of a roller coaster. Many ups, some downs, but overall, I think we would all agree, a remarkably uplifting and exhilarating ride. I think it's been exhilarating because of the synergy that we've built up between the community and researchers, something I think really has developed over the last 5 years. We all have experience in our own institutes and on collaborative programs of philanthropists supporting large and small medical research institutes, some giving small donations, others giving incredibly large, each to their ability. Some supporting our biggest medical research institutes, others in small boutique areas. And I think what has really impressed me is that those members of the community that want to do that in addition to supporting research through their taxes, something that they do through National Health and Medical Research Council, now the Medical Research Future Fund. They're absolutely passionate, and many want to provide not simply funding, but to engage and sustain the researchers themselves, the scientists, helping them through their own roller coaster ride of science. And we all, anyone who's worked in the lab or in the field or in public health knows that science is a roller coaster ride, and having those interactions with passionate members of the community is what often gets us through the darker times. It's also been exhilarating because I think that community's passion over the last 5 years has been translated wholeheartedly to their elected representatives, and I count it very much as one of my life's greatest privileges to have been able to accompany advocates like Connie Johnson and Alistair Lucas to meet dozens of members and senators, both as part of the Discoveries Need Dollars campaign and the What's the Fuss campaign, but I think even more importantly as part of day-to-day, week-to-week and month-to-month advocacy. Privilege has really not simply been to better get to know Connie and Alistair and the countless other community advocates that we work with, but I think also to see our elected representatives at their best. Not focused on the news cycle or the electoral cycle, not trying to score political points, but rather focused on creating a better Australia, healthier, economically prosperous, sustainable and innovative. And I have to say that across the political spectrum, I've really been touched with the sincerity with which almost every elected member of Parliament has expressed those feelings about health and medical research, because they know people in their community that are doing it tough through diseases that we wanted to prevent. And I really wish more Australians could see this side of our members and senators and see that more often, because I think it is very inspiring. It's exhilarating because as a nation we've created a lasting legacy. We'll look back on the establishment of the Medical Research Future Fund, I think, as a landmark, coming 80 years, almost to the month, I think, after the establishment of the National Health and Medical Research Council in 1936. The MRFF provides a second major source of funding for our nation's health and medical research at a level that's similar in scope to the Wellcome Trust in the UK and the Howard Hughes Medical Institute in the US. While the MRFF is clearly the child of the coalition, it wouldn't exist without widespread community support and with overwhelming political support in both the House of Representatives and the Senate, and again I think that will be well for the future. It won't deliver on its full promise without continuing support of the community, continuing political support, continuing guidance provided by Martin Bowles, Erica Kneep and the Department of Health, that I think have done a fantastic job in the initial phases of the MRFF development, and it certainly won't deliver on its full promise without the acclamation of our sector. The past 5 years, I think, have also been exhilarating because we've matured a lot as a sector. Although we are a very diverse sector in terms of size, our members range from 30 staff to more than 1,000. From boutique institutes focused on single diseases to those covering a real breadth of diseases, from those working at the basic and early translational end of the spectrum, all the way through to those working on public health, population health, We have diverse governance arrangements. Some of us are independent, some university-based, others embedded in hospitals, part of the aid sector as NGOs. There's much, much more that unites us than divides us. Our nimble structures avoid the often Byzantine layers of bureaucracy that beset other research organisations. We're committed to collaboration rather than fighting each other for national rankings or international rankings. And we have a shared commitment to impact rather than simply activity. We're not so much interested in paper counting, academic paper counting, but are interested in those academic publications that really shape international thought. Those papers that are read in Beijing or Boston or Belfast, Frank, and really shape the work that other international scientists do. We're not so much interested in patenting for the sake of it, but are entrepreneurial in the way we interact with industry. We work really well with small, medium and large companies like CSL, the only manufacturing company in the ASX top 20 listed companies, and a great partner to many of our members. And we work with them to develop the intellectual property into products, create jobs and build the economy. And that's something that as a sector we're really proud of. We're not interested in interacting with the healthcare system passively, but really are committed to embedding research into community behaviour, into primary care and into hospitals to improve disease prevention, diagnosis and treatment. And in the end, to make the system more sustainable so that as a nation we can afford the inevitable medical breakthroughs of the future, and we can afford them for all of our people, not just those that are capable of paying. I think we're a great example of the synergy that can be created when researchers work with the community, with the healthcare system and the private sector. And I'm really optimistic. But as we look to the future, I don't think we can afford to be complacent. We must continue to engage with the community, engage with the healthcare system, and engage with the private sector to better leverage government investment. We also need to better deliver on the aspirations of the community for better health and better jobs. We must continue to work on increasing the efficiency of the research system. And I think we've all been heartened by the approach of the CEO of the NHMRC, Professor Anne Kelso, and her commitment to reforming the grant system. A system that encourages around 5,000 applications per annum with a success rate that's heading towards 10% is unsustainable. It takes researchers away from what they should be doing, which is making discoveries. It demoralises those who've made medical research their life, and it paints a bleak picture for the sector for those considering it as a profession. We have to do better, and we have to support the National Health and Medical Research Council in reforming the system, and I think it's something that we are all keen to do. Finally, we need to come up with a simple, transparent and equitable system for funding the full cost of research. Research grants from the National Health and Medical Research Council and the Australian Research Council can only be used to cover direct project costs. All the other costs associated with undertaking or managing that research, such as IT support, electricity, labs, consumables, HR support, etc., have to be found from elsewhere. And it means the more successful the institute is in being awarded highly competitive research funding to find cures for terrible diseases, the bigger the funding deficit it has to reach each year. And while this is an issue that keeps almost every medical research institute director awake at night, I think the complexity and obscurity of the issue would likely send everybody else into a deep slumber. So I'm going to give you one analogy. It's like asking people to bake bread, but without an oven. We're giving them the funding for the flour and the yeast, but we're not providing the money to fire up the oven. We have to find that money from somewhere else, or we can't do our research. There's various different federal and state government funding schemes that bridge that gap, but they only bridge it partially. And in the end, we're asking mums and dads providing philanthropy to give generously to cover the rest. But I have to say, as a director, I'd be rather asking those people to give money to fund the research and not fund the electricity bill. For at least the last 18 years, and we only went back 18 years of federal reviews, review after review commissioned by the federal government has highlighted this as an issue that needs fixing. The Watt Review, the Ferris Review, the National Commission of Audit, the McKeon Review, the Bennett Report, the Cutler Review, the Bradley Review, the Grant Review and the Wills Review have all looked at the issues and highlighted the need for action if the problem remains. I'm not necessarily standing up to the Minister and pleading for more money, but I am asking for something that is a little more difficult than that, although that may seem a difficult challenge at the best of times. I'm asking actually for a whole-of-sector approach and across-departmental cooperation, especially between health and education, along with the willingness of the state and federal governments to engage. And while it's difficult to sort out this clumsy scheme, it's nowhere near as difficult as preventing cervical cancer, or curing leukemia, or building a bionic ear, all great things we've done as a sector and as a nation. And surely I think we can rise to the challenge of indirect costs. Just to finish, since I joined the AAMRI board 5 years ago, along with the privilege of working with remarkable members of the community, remarkable politicians from all parties and independents that I've already touched on, I've also had the privilege of working with a number of remarkable colleagues, Medical Research Institute board chairs and board members, MRI directors, staff and students. And I just want to highlight a couple of people for special thanks. I was president-elect while Brendan Pratt was president, and I like, as I've said previously, I like to think of me being Barack Obama to his George W. Bush. Brendan was generous with his guidance, and then as past president, when I moved into the Oval Office of Medical Research, was fulsome in his support. Also had the privilege as president to work with our president-elect Tony Cunningham, and I'm not going to do the analogy for Tony, who I know will do an outstanding job beginning tomorrow. And I'm really delighted you're taking over tomorrow. And I'd really like particularly thank But I also want to finally acknowledge someone who within our sector is very well known to all of you, perhaps less well known outside the sector, and that's Dr. Nicole Nelson. She was our Director of Policy and Operations for more than 4 years before departing a few months ago to take up a position with the Baker IDI Institute. Nicole, as we all know, has been the heart and soul of AAMRI. She's somebody, I think, who has been responsible for the renaissance of AAMRI, placing it in such a wonderful position. And on behalf of all of the Australian community and the AAMRI members, Nicole, I'd like to thank you, and I'd like to ask you to come up to accept a small token of our appreciation. Messages, I think, from all 47 institute directors and a print of scientific animation. So, Nicole, thank you. And I'm going to hand that over to Bernie. Thank you all so much.